Welcome back to the Real Life Pharmacology Podcast. On today's episode, I'm going to cover calcium channel blockers and more specifically the dihydropyridines. Common examples of dihydropyridine calcium channel blockers include amlodipine, which is brand name Norvasc, felodipine, brand name Plendil, nifedipine, brand name Nifedical. Mechanism of action with calcium channel blockers is as it sounds. They block calcium channels, which basically leads to relaxation of smooth muscle and vasodilation, therefore lowering blood pressure. Most common use that I see these medications used for is hypertension or high blood pressure. Adverse effects. Most common adverse effect you're likely going to see is dizziness, lower blood pressure, as well as the potential for edema, peripheral edema. So swelling in the ankles, swelling in the lower limbs is something that can definitely happen and does happen in clinical practice. This is a dose-dependent effect. So basically what that means is the higher the dose, the more likely you're going to run into this adverse effect. In clinical practice, what I've seen numerous times, especially in patients on numerous medications, where this might slip through the cracks, is an order for Lasix soon after starting and or increasing a calcium channel blocker like amlodipine. So again, look out for those medications that get rid of fluid and help treat edema. Be sure we're looking at our medication list prior to adding any type of diuretic or water pill. So I mentioned these are dihydropyridines. There is a class of calcium channel blockers called non-dihydropyridines, and they act more so on the heart, which I will talk about in another episode for sure. But just remember that amlodipine, felodipine, nifedipine, these medications aren't going to act on the heart. So what that means is we don't need to monitor pulse rate typically with these meds. Blood pressure, yes, of course. That's generally what we're going to be using these meds for. Other, common compelling indications you might see these meds used for. Occasionally see them used for like Raynaud's disorder, maybe angina, chest pain, that type of thing. And so keep that in mind. If you do see these, they aren't always 100% used for hypertension, but definitely that is the most common thing there. Rarely you will see constipation. It probably isn't crazy common with the dihydropyridine calcium channel blockers, but it is something to think about if you've got a patient with really severe constipation and you can't really pinpoint any of the other classic medications like opioids and anticholinergics and maybe iron supplement, things like that. There are some clinically relevant drug interactions, and probably the most common one that I see is amlodipine used with simvastatin. And there's a recommendation to limit the dose of simvastatin to 20 milligrams if a patient is on amlodipine. With this said, I have seen some clinicians go through that limit. Generally not something I recommend. Likely we can probably switch to a different statin if this drug interaction is a problem or is a concern. The end result of this interaction, and why some clinicians choose to maybe leave it alone, is elevated simvastatin concentration. So maybe a patient's a little more at risk for myopathy or some of the adverse effects from statins due to this drug interaction. But again, if a patient's been stabilized, maybe they've been on both medications for 3 years, for example, you may see some clinicians choose to leave the doses alone, depending upon the doses that they're at and their past experience that way. As far as dosing and administration goes, not a ton of really important clinical pearls or anything there. Amlodipine is by far the most common calcium channel blocker I see utilized, typically dosed once daily. I will occasionally see it dosed twice daily, which, depending upon the situation, may or may not be the right thing to do. Always important to remember, if you go to twice daily or multiple daily doses, adherence can get a little more challenging for the patient. Again, that's a patient-specific factor that you've got to figure out when working with your patients, but typically once daily in most situations for the amlodipine is going to be adequate and last long enough as far as the half-life goes. I think that wraps up calcium channel blockers. Again, these are the dihydropyridines. I know that's a common mistake. People get those mixed up with the non-dihydropyridines, but again, amlodipine, felodipine, nifedipine all end in that PINE, and they are dihydropyridine calcium channel blockers. Thanks for listening to this episode today. Feel free to check out reallifepharmacology.com. Again, I've got a free giveaway there, free practice exam, 100-question exam of absolutely no cost to you, simply for subscribing to the website and following the podcast. I appreciate you guys listening today, and take care and have a good day. Whether you're a nurse practitioner, nurse, pharmacist, pharmacy student, med student, meded101.com has a growing list of great resources to help with board exam preparation, as well as becoming better at medication management and pharmacology. meded101.com/store is a fantastic resource you need to check out. Again, meded101.com/store, STORE.